It's often very challenging to figure out whether the radiation therapy program at a community center that might be close to your home offers the same opportunities as a radiation therapy center that might be further from your home or maybe more located with a larger cancer center. The best way I would think of looking at that equipment and capability is working with your primary cancer physician and then asking questions of the radiation oncologist that you meet, such as their expertise and experience treating kidney cancer, as well as their availability of machines that could give other radiation therapy options for kidney cancer, such as MRI guided radiation or proton radiation, or other advanced ways to give SBRT or stereotactic body radiation therapy. These differences will not be immediately apparent unless you ask the questions. And so, being an informed patient who doesn't mind asking a few questions from their practitioner, that's going to be the best way for you to understand whether your center that might be close to home has the same options for therapy that a cancer center further away from home may offer. We do know that one aspect of tumors that makes it harder to treat with radiation is their size, and that the larger the tumor, the more challenging it is to treat with radiation. But there isn't a hard and fast fixed guideline of how big a tumor can be for it to be treated with radiation. And we can still control many tumors that are pretty large, greater than 10 centimeters in size, with radiation therapy. It all comes down to the details of where the tumor is located and what it's next to that we have to avoid radiation. Radiation therapy can sometimes be the best choice for a primary kidney tumor. There has been recent data from a multi-institutional study that was led by our colleagues in Australia, where using SBRT, or this targeted high-dose radiation delivered in a few treatment sessions, can be effective for kidney cancers that are not amenable to surgery or ablation. Being evaluated at a center which can offer both surgery, ablation, and radiation for kidney cancers will ensure that this option is looked at for you. We commonly use radiation therapy for patients who have kidney tumors that either by their location or by spreading to an area such as the bone cause pain. Radiation therapy to treat these tumors to decrease pain is well known in its effectiveness and safety. When a patient is coming down to be seen for radiation therapy, the process is as follows. First, there's a meeting with the patient and the radiation oncologist to discuss all the aspects of the radiation, why it's being done, how it would be delivered, how long each treatment would be, and what side effects to expect. The second part is called a simulation. This is where the patient comes to the radiation therapy department and they will be set up in a position that is best for treating the tumor that we're aiming at. For example, if the tumor is in the kidney, they might be laid down on a table with a device set up to make them comfortable, but also allow them to raise their arms up, as that would be the best position to safely aim radiation at the kidney. During that time, we often would do a CAT scan and maybe even an MRI and put some tattoos or marks on the patient to show how we would lay them down with each treatment. This session often lasts an hour or up to 2 hours. For the individual treatments, the patients come back and lay down in that device that was created at the time of simulation. And treatments can be anywhere from 20 minutes to about an hour for treatment. You don't see anything or feel anything during treatment, and patients are safe to drive themselves to and from treatment on their own. Radiation therapy can be safely delivered when we are very particular about aiming the radiation at the specific tumor so that we avoid the things nearby the tumor. This would be easy if we were big solid lumps of wood. You would just put the piece of wood on the table and you could aim very precisely. Unfortunately, we as people are big bags of water, and so we have to do extra things to make sure that the tumor is in the correct place. For example, when we're trying to precisely irradiate a tumor that may have spread to the brain, we would like to use a mask and something to hold the head very still so we can precisely aim the radiation at the tumor in the brain and not other areas of the brain. When we look at treating a tumor in the kidney or in the lungs or maybe in the abdomen somewhere, these tumors move while we breathe. And so we might add a device to have the patient hold their breath or to even put a compression around their abdomen so that the breathing is minimized, so the tumor doesn't move as much while they breathe. All these things are done not to make somebody uncomfortable, but to make sure that we can set up the radiation so it's aimed at the tumor and stays away from the other organs of the body that we want to avoid radiation to. In deciding whether radiation therapy is a good option for your kidney cancer, the places that can best help discuss this is making sure that your providers is part of a multidisciplinary kidney cancer treatment team. At centers that specialize in treating kidney cancer, there is always a group of different physicians, often a medical oncologist, a surgeon, interventional radiology, radiation oncology, palliative medicine, and other supporting team members in radiology and pathology that can meet on a weekly or every other week basis to discuss patients who need to look at different options for their kidney cancer. I think that these meetings, where everybody brings in their individual expertise, gives the best option for any patient with kidney cancer.